Good afternoon, everyone. The time is now 4:03. I call to order the meeting of the Health and Mental Health Committee, and a copy of the agenda for this meeting may be found on the county website underneath the tab for the legislature. Please silence your phones and electronic devices at this time. I ask you to please rise for the pledge of allegiance. Thank you. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Would you do a roll call, please?
Emo. Here. Magnusakis.
Present.
Ellers. Keller.
Here.
Ramos. Sutherland. Here. Hotel. Here. Chewy.
Here.
6 present, 2 absent.
Okay, just before we start off here, I'd like to, I'm going to move the item number 4 up here to the first position, and then we'll pick up the agenda on after that. And item number 4 is Kathleen Benelli, Chairwoman, Orange County Legislature. Michael Amo, Legislative Chairman of the Valley View Advisory Committee. Request approval relative to the RFP award for the Intergenerational Continuing Care Campus at Valley View Center for Nursing Care and Rehabilitation. Can I get a motion, please?
Second.
Okay. Ron and Lloyd. Okay, Chairwoman or Michael, whichever.
Thank you, Mr. Chairman. We're here this afternoon to present a very exciting proposal that's been a long time in coming. I know that you've heard me say this before, but it does bear repeating. The concept of creating somewhat of a development out at the Valley View campus to enhance that facility and complement the good work that that does was something that legislator Amo and I talked about at least 10 plus years ago. And we've gone through various different processes with Valley View and trying to be as sustainable as we possibly can with the facility. And in an effort to do that, this is where we are today as a culmination of ideas. We put together a very vital team. And Lawrence Ledoux, the director of Valley View, was part of this, along with Anne-Marie Maglione, Office for the Aging, and other department heads, as well as advisors. Our own legislative counsel was very helpful in all of this, and quite frankly, a great partner for Michael, and Michael can attest to this too, is our own staff. Dorian Griffith worked very closely with Michael to make all of this happen. So this afternoon, we have reached the point where we wanted to discuss this with all of you, discuss the process, and move forward with getting some more ideas to develop this particular venture. So I'm going to turn it over to Legislative Amo with much thanks and gratitude for
Thank
your
you,
work.
Chairwoman.
Thank you, Mr. Chairman. We're at a very interesting point. We begin with a little history that she talked about quickly. This process has been in work for about 5 years. Jimmy O'Donnell chaired the committee for 2 years, began to look at what could we do with 148 acres at Valley View that would increase the sustainability of Valley View and help provide a service to the constituents of Orange County. That was sort of the initial question. After 2 years, Katie appointed me. I took it over 3 years ago. And what we did is we synthesized all the work Jimmy had done and got it, had O'Donnell done, and got it down to a list with the help of the planning department of key issues that we thought we needed to include on this campus. Then we brought in experts. We asked them to come in, the leading age group, which is a not-for-profit group that represents nursing homes in the state, in the country, in the state of New York. They gave us a sort of testimony what we should do or not do. We had other people come in and talk to us about ideas that would work or not work. We kept bringing that all together. And the single most important thing that really came out of it is that we realized it was sort of a bifurcated process. We really needed, first and foremost, a master plan. It said, this is what this campus will look like in accomplishing the goals that the committee has set out for us. And then the next step of that process will be, how do we do it? So what I'm bringing you today is the results of the RFP that went out. And it's available to me, and I can hit the high points, and I won't bore you, which looked for individuals who are willing to help us build a master plan and develop that process for us, help us think it through, work it out, collect the data we needed that was sustainable, not only to Valley, but to Orange County. Because certainly we want to create something that 3 years from now didn't work. So we needed to get the data about what was going on in terms of the aging demographics, what was missing in the county, what did people want? Any of us who have begun to think about what we're going to do after we become 65 or 70, it's a process to try to look at how do you do it, how do you pay for it, how do you make it work for you? That is not really tied together. Our Office of the Aging does a great job with that, but maybe there's more we can do. And so that's sort of the question. So the RFP went out, and it basically said we're looking for a master plan. So we wanted someone that could tell us we could do that. We wanted to create a campus that was standalone. Valley View was not included in the proposal. Valley View is a separate entity. This is a campus that will sustain service we need for the residents of Orange County, and at the same time will provide sustainability for Valley View. And let me just speak to that for a second, because that sustainability needs to be explained. Certainly, the kinds of things we do on that campus should be attractive to people aging or aging in place or looking to do that. And where do they go to find it? So some of the things we envisioned when we talked to them about this was, well, okay, maybe you need something like a welcome center. Maybe you need an educational center on the campus. Somebody can come and say, gosh, I'd like to do this. What's the right thing for me to do? Or I'd like to live at home, but I need these kind of services. And have somebody that could talk to them about it. So that was a central thinking part. How that gets rolled out, we don't know. And then we began to think, what would be all the supportive things you would need if people were coming to look at those kind of issues on the campus? And we began to think in terms of the RFP when Anne Marie talked about 86,000 individuals are above the age 60 right now in Orange County. And that's the size of the demand that we have for services. It may not be a Valley View, so 260 beds. You got 86,000 people out there that have all kinds of needs of broad range. So how do you provide a service as a county to help people work their way through that? We don't know how we're going to do that. The second thing is that, and Lawrence was quite important, he was on the committee, the Valley View Advisory Committee with us, is that, the things we have to do is, if it's going to be sustainable in Valley View, how do they work together? Even though they're separate entities, one's a county program and one is not necessarily, well, they do, because you may need referrals. It would go from there to Valley View, which would help Valley View. You may have rehab cases that would go the other way, child cases would go, so you can have a real working relationship. And so it would help the sustainability, we believe. And so that's really what we went out with. So we sent out the RFP, I can get in more detail if you want to know, but we sent out the RFP. And we had, well, just back up before, because we hadn't mentioned it, talked about it. We sent out the RFP and we established 2 subcommittees that would work on responding to and evaluating the RFP. We had a scoring committee made up of 6 individuals, myself, Mike Paduch, Lawrence Ledoux, Paul Wiley, and Anne Marie Maglione. Joe Menuda as an architect came on, but then he was seen himself more as an advisor. And we had advisory members made up of Peter, Betsy, Abraham, Alan Sorensen, and Sam from General Services that we could call on if we needed help in terms of trying to work our way through the evaluation of an RFP. The RFPs came back in, and I guess many of us were kind of surprised. We didn't know what would happen. We had 6 RFPs come in, 6 proposers come into it. And they were proposals from all over the country. Some local, some Chicago firm, Baltimore firm, Minneapolis firm came in. I think that was a 60, maybe no more on this, and I could get it if we need to talk about. And the ranges of price were really quite amazing. From 150,000, 40,000 up to almost $1 million. You said, why? What's the difference here? Why did they see it differently? We got to talk about that and think about why. And so we waited. Our group committee that we had here read all 6 proposals. and even Peter had them too, as the chairman of the community advisory, and look to see, rank them, who's really hitting spot on to what we think we want done. Like, and you can jump in more, if I'm saying anything.
You're doing a great job, everybody.
I mean, this is you're not, in case I'm missing something, and we then ranked this, we looked and ranked all 6 of them. Had lots of discussion about it, and it was the consensus of the group that we thought half of them, 3 of them should be brought in for interviews. Based on their RFP proposal response and what they did. We set up Zoom meetings and we scored them all, so we have a scoring sheet for that. We then brought them in by Zoom and gave them an hour each to talk to us about how they thought their company could do what we were trying to do based on what our RFP said, and tell us their strengths, their weaknesses, and they told all that stuff, and they had the floor. We then asked questions, and after that was done, fairness to everybody that left, when they finished up, we rescored. And then we reconvened, and we said, okay, on the rescore, let's rank those 3. And we ranked the 3, and the group that I mentioned to you unanimously came up with one company. That just seemed to stand out by the group. It wasn't one person and having a high score. Amazing. Everybody said that's the one, within points. Now, a lot of them are close. These are good companies. So we got it done with that company. And what we're gonna do here today, asking you to do, is give us approval to send that to the floor of the legislature to begin the process of developing a contract with this company. And the reason I'm being vague, is that I cannot release the names publicly of the proposers because they have not been notified of our decision, because that's us here. We have to make it here. If you say no, go back and do something else, we'll do that. But if you say yes, then we got a person, we got a company. We can't tell too much. If anybody needs to have information, as Peter and I talked about, that's more specific, we can call executive session and I can answer your questions. But basically, what we're asking is to pass a resolution to move this recommendation of the Valley View Advisory Committee to hire one particular company to the floor of the legislature. By the time it reaches the legislature in the meeting in March, the proposers will have been told who won, who got the contract, who won the review, who didn't. At that point, it's public. And so we can then talk publicly about everyone, about the company that got it and what we did, and we can answer questions at the legislative meeting. I can answer them here, but I gotta do them in executive session. That's all I have. I think that's it.
Great, thank you, Michael, for that explanation. And just to remind everybody that the purpose of this committee is to accept the recommendation from the Valley View Advisory Committee to award that RFP and move it to the entire legislature in March. I'll open up the meeting to any comments from fellow committee members. And just keep in mind that what legislator Amos said about that it hasn't been awarded yet. So be careful what you want to ask. And then if need be, if you have any specific details that you're looking for right today, we could, I'll refer to counsel regarding going into attorney-client privilege. Okay, so with that, anybody have anything? Or?
I think we want to
Legislator Tortel?
make a motion to go into executive session so that, because the proposal hasn't been distributed to everybody on the committee, so that we can all have a chance to look at it, vote on it.
Okay, I'm gonna ask
I'll second that motion.
counsel whether if there's a difference of going into executive session or to simply go and to attorney-client privilege.
Yeah, so for this instance, we're going to go into an attorney-client session to address the particular issues with regard to the RFPs.
I'll amend
Okay,
that
do you
to
want to amend that?
attorney-client privilege.
Okay, second, Michael. All right, all in favor?
Aye.
Aye. Any opposed? All right, let's do that.
Pause the recording, Peter.
Here.
Tom.
Oh, it's like.
Okay, everyone, if I could get a motion to come back from,
So moved.
The attorney-client
client
session.
session.
Second.
Okay, Hotel and Sutherland, all in favor?
Aye.
Any opposed? Okay, thank you, everybody, for your patience, and, with that, I would like to, get a nomination to, vote for the approval of the RFP to move on to the full legislature.
It would be the approval of the recommendation of the Valley View Advisory Committee to issue that award to the recommended
To
entity.
recommend it.
I will make that.
I'll second that.
Okay. Sutherland and Tortel, with that, I would, call the question, all in favor, aye?
Aye.
Any opposed? All right, motion passes. All right, back to our originally scheduled agenda. Item number one, Darcy Miller, Commissioner of Social Services and Mental Health. Lacey Trimble, Deputy Commissioner, Department of Mental Health. And Lacey, if you could come on down, and you will be solo today. So thank you for coming and thank you for your patience. Up first, we have item 1A, request to create one senior account clerk, grade 7 position, and abolish one vacant principal clerk, grade 7 position. This is legislative request number 014. Can I get a motion?
So moved.
Second.
Hotel first and Mr. Fowler second. All right, Lacey, what do you have for yourself?
This position, we really want to just swap because the accounting background that's available in the newer title would allow for better oversight of the opioid settlement funds, which we have repurposed this position to cover. So when somebody left to go to the health department, they got a promotion to the health department. We decided to, before we fill it, switch titles, same grade, to make it more appropriate to the type of work that we want them to be able to do.
Any questions? Not seeing any, I'll call the question. All in favor, aye? Any opposed? Motion carries. All right, item 1B, request to create one executive assistant, grade 14, and abolish one executive secretary and administrative assistant, grade 11 position. Legislative request number 015. Can I get a motion?
So moved.
Okay. Sutherland? All right. Congratulations.
This position is the administrative assistant, executive assistant to Darcy. She requested a desk audit because of the confidential nature of the work and the increased work over the years. HR came in, completed the audit, and recommended that we increase to this title. We support that. She's a huge asset and does a phenomenal amount of work for our department.
And is this someone coming from within the?
It would be somebody from within. So at HR's recommendation, we would abolish the position after the person internal who would move up into this position has the opportunity to take her test and hopefully pass that test and be able to come to that position.
All right, any questions?
Keep going so they can go back to it if they don't.
Any other questions? Not seeing any, call the question. All in favor? Any guess, any opposition? Not seeing any, motion carries. All right, Lacey, item number 1C is your monthly update.
So I provided a few updates via email as requested. We did receive some responses back to our RFP for the round 2 of opioid settlement funds that we put out. Can't really discuss the details of that because we just received them back and we will be looking to score them. We have a committee that will review, score, and move forward with those. The first round of funding, we did update you guys on last time, but the ADAC Impact Program is now fully staffed with their prevention program, which is co-occurring mental health and substance use prevention. So they are currently in Valley Central, Pine Bush, Port Jervis, Monroe, Woodbury, Goshen, and the Highland Falls, Fort Montgomery schools. They will be moving in years 2 through 5 to be in all districts across the county is our hope. And so far has been really received well by the districts. The other major piece of funding from that was the Oxford House, which is recovery housing for individuals with substance use disorder. They have successfully opened an additional house that's receiving that funding, which is specific to women and capable of serving women and children, which is a huge hole we've had in our system for people who have children who need treatment, who have been unable to access treatment because there is nowhere for their children to go. This house is capable of providing that, and it's the first in the county that can do that. County operated clinic updates. We did move forward with our electronic health record upgrade. It so far has gone smoothly. It went live on the 12th. It will improve cybersecurity for us because we will no longer be using Java, and hopefully will be a little more user friendly for our staff. Satellite clinics continue to grow. We are fully operational now in the Goshen School District. Highland Falls has been submitted in complete status now to OMH. We're just waiting for that final approval, which we're hoping will come soon. And we have also gained approval to submit an application from the state for Washingtonville. So that one is now in process. The increase in satellites has produced almost 9,000 more services than we did in 2022 in our satellite programs, which for them only increasing by a couple additional satellites is over 3,400 more services than they produced in 2022. So it's a huge number. We just completed our corporate compliance program review for annual. It's part of our requirements for Medicaid billing. Found no compliance issues. We are continuing to work on the new regulations that were put out around billing for school-based satellites, which I shared last time is 125% of base rate, which my understanding is will also allow us for private insurances to collect a higher rate, which is significant for our total collection for our programs, and will allow us to expand further. And our satisfaction rates were very high in the Port Jervis Clinic. I don't have the data from Newburgh yet, but the satisfaction from Port Jervis was 96% would recommend the clinic, and 98% reported that it made a positive impact on them and their families. Other quick updates, the Gene Jonas Professional Development Symposium and Masterson Banquet was delayed in 2023. We had to postpone. It has been rescheduled for March 18th, and it's a whole community approach to threat assessment and management, really looking at targeted violence prevention from the behavioral health lens and how we can work with law enforcement partners and school districts and other entities to reduce the risk of targeted violence. I know Darcy has spoken to you about the Healing Community Studies many times during the grant process for that. That is coming to an end in March. Though we will be sustaining the newsletter, which will move to quarterly and be broadened to not be just opioids, but also be other substances that we're seeing an increase in. We will also be continuing the work around wound care because of the increase in xylazine and the physical wounds that are being seen because of that. So we'll be having some wound care summits in partnership with our partnership health department who's been working on this grant. We're looking to do multiple of those in the next year, get some supplies out in the community. We are seeing people with severe infections that lead to potential loss of limbs. SUNY Orange was approved by OPWDD to provide the micro-credential for direct service professionals. That will be fully funded, so people can take those classes and receive that certification at no cost, even books are included. Hopefully improve both the workforce and their capacity to provide professional service. And I think Darcy had mentioned in the past that the Brand Corporation had come to study our crisis response system, one of 3 that were selected across the country. They have made it through the peer review process, so they are looking to be moving forward with publishing of that study. We will be included as one of the potential best practices. And they are going to provide a virtual presentation to those who they interviewed to create that report to give us kind of a sneak peek on, what the study will say about their work. That's all I have for you.
Just in reference to the high school satellite clinics, is there any way, do they do any kind of review of the ones that have been up and running? Is there any kind of metrics that are tied to it, or, how many cases or anything,
Yes.
not, of course, going against any confidentiality or anything, but if you could just look into that for the next meeting.
Yes, it's all within our electronic health records. So we have average length of stay, number of sessions for each student. Engagement and continuation in sessions is one of the biggest metrics because the national average still remains 1 session. Last I checked, ours was 18 sessions on average per year.
Great, okay. Hang on to that. Any other questions? Legislator Ramos.
Just one comment, just to follow up on something Darcy kind of kind of happy to tell you, you can share it with her. At a couple of meetings, she presented the budget, the cost of the county paying for criminal procedure 720 cases at the psych centers across the state would be $1.5 million. I'm the vice chair of the Public Health and Mental Health Committee for NISAC, and we have a resolution on that committee to try to change that. So we expect there'll be a good amount of debate. I put it to your attention, if you have anybody that's actually going to be at NISAC, it's on Monday morning, 11:30. Catch it, any kind of help. I'm sure they know all the stuff that you know, but you know, it's important because we're trying to commit it. For those who remember what that is, and just don't want to hold a lot of time on people, is that when a judge in Orange County decides that a client is incompetent to stand trial for a felony and needs to be restored to competency so he can be tried, the judge orders him to go to a psychiatric program within the Office of Mental Health system. Usually, there's another couple of ways you could do it, but that way. And the Commissioner of Mental Health in 21 decided that they were going to charge us full 100% rate of their cost to care for that, to do that. And when we try to find out what it is they're doing, magic, they don't want to tell us. And so they could be there a month, 2 months, 3 months, 6 months. And Darcy told us at the meeting, it's costing Orange County about $1.5 million a year that we pay to the Office of Mental Health to take care of people that come from Orange County by our judges to go to the cases. And it used to be 50% of the cost, which was expensive but manageable. And for some reason, I guess in budget time, the Commissioner of Mental Health of the state said, no, it's going to be 100 from now on. And it became 100. So now we're dealing with it. We're hoping, there's a couple of proposals out there. We're hoping we can get something through the legislature to pass a law that modifies the hygiene. It's a big lift.
But it would make a big difference.
So we got it on the
Closer to
agenda
$2
and
million
we'll talk about it.
last year.
And a good chance of we get enough support for it. Maybe they can give the governor's office to think about it.
Thank you.
Follow up on Darcy, she should know that. That's gonna happen next week and just coming next Monday.
All right, thank you, Mike.
Thank you, I'm sorry to take your time up, I didn't tell you in advance, I just thought about it.
No, thank you. Any other questions? No? Okay, thank you, Deputy Commissioner. Appreciate it. All right, agenda item number 2, Lawrence Ledoux, Commissioner, Valley View Center, Donna Strecker, Director of Finance, Valley View Center. Welcome.
Good afternoon. How are you?
Good. Item 2A, request supplemental appropriation of funds for the proposed 2024 capital project, capital expenditure to purchase fees, fiber optic endoscopic evaluation of swallowing, diagnostic equipment, $25,000 bonding. Legislative request number 020. May I get a motion?
Second.
Sutherland and Tortel. Okay.
So, yeah, this is a device that, just as it says, it's a fiber optic endoscopic evaluation of swallowing. It's a device that will be used by our speech pathologist to evaluate residents' swallowing capacity. So we currently have a contractor that does these services, but if we purchase our own equipment, our staff on site can do it. And that's what we want to do. We would like to purchase this piece of equipment for the $25,000 instead of having to contract out this work to a different vendor.
Okay, and but up until now, you've been going out, you said?
Yes.
this vendor?
Yes.
And so will this be a cost savings to the taxpayer?
I don't have, I didn't bring how much we've spent on this. In the past, I could send it to you though.
Sure.
Sure.
Okay. Legislative talk.
Oh, we
Thank
have-
you, Mr. Chairman. What is the light?
Hold on one second.
Oh, so we have, I'm sorry, in our proposal, we have that, we don't send too many residents out. It's about, we spent about $3,000, the first quarter of, this is only for the first quarter of 2023. This is when we got the quote. So I'm sure it's higher than that if you take in the whole year.
Yeah.
So,
We'll pay for stuff in 2 years.
yeah, I mean, yeah.
Well,
Okay,
Okay.
legislative.
hopefully at the time that our people are gonna be performing the test. I mean, they're gonna get paid while they're doing the test.
Oh, yeah, okay, okay. So,
Sam's people.
I didn't-
Right.
Are we going in a free for all or?
Yeah, but that should be billable though too. Of our people, do the exam, that we'll be billing for that as opposed to the,
Okay,
Right.
legislative cartel, up
Thank you.
next.
What is the life expectancy or the attrition rate of this equipment and how long does it last? Is there a service contract involved that is the maintenance contract or warranty on
I
here?
think it has to be calibrated. I don't have a life expectancy. I'm not
We
really
can find
sure.
that out,
We can
yeah.
get that for you
Yeah,
though.
if you could get that for us with the other information, the life
Sure.
expectancy, does this plan include the calibration contract? I don't know how often it will have to be calibrated. Anything along those lines.
Sure,
I appreciate it.
no worries. Yep.
Thank you, Mr. Chairman.
You want, okay, I have legislative Sutherland.
I would also imagine would be tremendous to have it on hand, because then they're also not waiting.
Cool. Well, that's one of the primary
Because
benefits.
I
We,
know with my grandmother, that was a tremendous thing. So
Yeah.
I support this completely.
thank you.
Okay, any other questions?
No, sir.
Okay, all in favor?
Aye.
Any opposed? Not seeing any, motion carries. Agenda item number 2B, request to authorize the county executive in conjunction with the Valley View Center for Nursing Care and Rehabilitation to submit a grant application to the New York State Department of Health for the statewide healthcare facility transformation program 4 and 5, health information technology, cybersecurity, and telehealth transformation. Submission of the grant requires the applicant to comply with the requirements of Article 15A of the New York State Executive Law, participation by minority group members and women with respect to state contract by providing opportunities to minority-owned business enterprises, MBE/women-owned enterprises, WBE participation, and to certify the county will maintain such records and take such actions necessary to demonstrate such compliance. The grant request is for an estimated total project of $600,000. The source of funds is state grant funds. A local match is not required. If awarded, the grant will be used for an anti-elopement system, which will integrate into existing nurse call system to significantly improve safety and security of residents/staff at the Valley View Center. Legislative request number 034. A motion?
So move.
Showtime and Amos?
Excuse me, sorry.
Okay, go ahead. Amos.
I just think the key points are, this is obviously a grant and we're applying for it. The total cost would be $600,000 as it mentions. There is no matching, which would be great. And this system, we have an anti-elopement system in place, but the upgrade for the anti-elopement system would allow us to track a resident if they get off of their unit in real time. It would, the elopement system would tie into our call bell system and we'd be able to see where the resident is, on a screen.
Track
So,
it. And
yeah.
would that be also go out of the building?
Exactly.
Okay.
So we would have a tracking mechanism. So that's the whole,
What kind of radius does it have?
I don't know how far out of the building, but I mean, at least if they're within the building, we would know pretty quickly if they got off of a secure unit.
Don't get too far.
Yeah.
Good.
So that's the whole idea.
All right. Any questions, comments? Not seeing any. Call the question. All in favor?
Aye.
Any opposed? None. Motion carries. Next up, we have item 2C, monthly financials. Donna, you want to take that?
Sure. The first one we'll be reviewing is a December 2023 that was updated as of 2/8. So the IGT funding that we received was $13,945,000. Other revenues coming in at $33,861,000.
On the personal service side through 2/8, we've expensed 19,607,000. On the contractual side, we have expensed 12,784,000. The indirect cost has posted, that was 1,929,000. That's for county services, benefits at 16,148, and a small amount of serial bond debt at 72,746. There are still some pending entries for year end, the post-retirement, the benefit obligation, interest income, as well as the payroll accruals for year end. So the numbers that we're reviewing are preliminary in nature and don't represent yet the final outcomes for the facility.
Questions? Okay.
Okay. And I believe that the next one you have is, oh, okay, you have the graph.
January, right?
January. That was in December you're looking at, right?
Right.
Yeah, this was December. So if you look at our year-to-date census for December,
Your census, gotcha.
yeah, it was updated through December, 65.47% based on 360 beds. And if you base it on occupancy, actual beds open, 270 was 87.30. I'm gonna fast forward right to the January financials. January is a kind of a slow month because we're busy working on year end. Not a lot of new activity, so the highlights are the revenues coming in at 2,945,000. Personal services, we've expensed 1,468,000. On the contractual side, we have 5 million earmarked for expenditure. We've only expensed at this point in time for the first month, 178,491. Employee benefits coming at 1,217,493, and a small amount of serial bond interest. And we go to the next page. Do you have this one? Okay. So I just want to point out there's a clerical error on this. The last column on here should say, the last two columns should be labeled 2023 and 2024. You'll see it says 2022 and 2023. So our census for January, we came in at 65.47%. January of the prior year, we were at 65.19. And if you turn to the final document, you'll see our payer source, insurance bill type. Our Medicaid population in January, 74.12%. We had our Medicare at 13.70. And those are the highlights for January of 2024.
And private, got 10.48. It seems like in the past that's been a little bit lower, because it's just been more people starting to do private pay.
Well, last year it was at 6.38, but we do have a couple of people in house.
Yeah, that's high for us. The private pay percentage is always a kind of a moving number because also, captured in that number are Medicaid residents that are pending Medicaid. We have to list them as private pay for our financials because they haven't converted to Medicaid yet. So it's always a little lower than the actual number, but yeah, that is a little higher than normal, yes.
Okay,
That was a good observation.
gotcha. All right, and any questions, comments? No? You guys have anything else?
I just have the monthly update. I think I sent it to you guys.
You did, I saw that earlier.
So for January, the census as of Friday was just under 64%. I think today it was over 65% because we had a bunch of people come back from the hospital, which was good, and some new admissions. But for January, we had 18 new admissions to the nursing home and 17 discharges. The discharges included 6 deaths and 11 discharges to home. We still have the 3 units closed due to the staffing issues. We are admitting short-term rehab residents and occasionally long-term residents as beds become available. Our CHA census is 19, which is strong. For January, the CHA had 8 new admits, 4 discharges, and conducted 202 therapy treatment sessions at Orange County citizens' homes. COVID numbers have improved. We currently have no COVID positive residents and no COVID staff currently, so that's good. We are requiring our staff to wear a mask while working with residents based on the New York State Department of Health recommendation. We're proud to announce that we're going to have a Orange Ulster BOCES CNA training class at Valley View. It'll be starting on March 18th, so that's good news. I forgot to include this in my write-up, but we did issue our contract with our accounting services. O'Connor Davies was up and it had to go out to bid. It was published. The RFP was published in 2023 for the accounting services, and the bid was awarded to HM&M for Valley View. And we will begin our annual audit sometime in March. Coming up.
Hey, just a quick question.
Yes.
With the CHA at 19, is that an all-time high for you? Or?
I think it is. Yeah, I don't know if we've reached 20 yet. I think the highest has been 19, but it's a good number for the job.
That's great.
It's a good number,
That's a one-time kind of legislative.
I just want to say, I have a student who had an experience for the first time over at Valley View, and she absolutely positively loved it.
Oh, great.
And I'm thrilled to see about the CNA training.
Oh,
That's
good.
what we're gonna be doing partnering.
What,
with
the
those
student, was she in the principles of health class or?
No,
or-
the HHN.
Oh, good. Oh, yeah, we have them coming through. We have principals of health students coming through. We have nursing students that are doing part of their clinical rotations coming through. We really
Thank you so
enjoy it.
much.
Yeah, it's great. We love to have the students on site. So, and we're excited about the CNA class too. So,
And just one other thing too, when, with the hiring of new nurses and new employees, everybody, do they need to be vaxxed or?
they don't have to be anymore.
They don't
No,
have to.
the mandate was lifted a while ago now.
Last
So,
month
yeah,
or something? Yeah,
yeah.
okay, thanks.
So, yeah, yep.
You're welcome.
Welcome both.
Thank
Okay.
you.
Lawrence,
Ron Feller,
nice to meet you. Where are you from?
Montgomery.
Montgomery, right? Okay. If you ever want to go over the financials or if you have any questions, let us know.
Yeah.
All right?
Nice to meet you.
Yeah. If you're looking at the financials for the first time, it's like, it's
Yeah.
hard to read, but we can,
We can
run you
help
through it. So, all right.
Thank you.
Yep.
Take care. Good
Ron,
day.
they might even buy lunch for you.
Now you're pushing it, Mike.
$75 for the whole year. I gotta space it out.
All right, agenda item number 3, we have Dr. Alicia Pointer, Commissioner of Health, and Deputy Commissioner Lisa Lahip. You're out here. Deputy Commissioner of the Health Department, and good afternoon, ladies.
Good afternoon.
Item number 3A, we have a request supplemental appropriation to appropriate year 3 funds from the New York State Department of Health for the Healthy Neighborhoods Program. Grant for the period of 4/1/2024 through 3/31/2025 in the amount of $275,000. It's legislative request number 031. May I get a motion?
So moved.
Sutherland and Tortel. Okay, you're up, Doctor.
This is for our Healthy Neighborhoods
Did
program.
you say what's up? Doc?
No, I said you're up. No, I said-
I got a hearing problem. I heard that's great, Peter.
I said you are.
I'll answer to whatever.
What's up?
This is a great program, if I do say so myself. I actually did a ride along with them last month in Port Jervis. So this program looks at health and safety issues in people's homes. It's a voluntary program, so you can self-refer or be referred through a community-based agency or a provider. And they do things like evaluate your house for health hazards. So if you have asthma, they'll maybe give you a mattress cover or look at like air quality issues. They give out smoke detectors and carbon monoxide detectors, cleaning products. They also collaborate very closely with our lead program. So if they see lead hazards in the home, they can easily refer to our lead program. So this is to continue the work of that program.
Great. Any questions or comments from committee members? Not hearing any, I'll call the question. All in favor, aye?
Aye.
Any opposed? Not hearing any, motion is carried. Thank you. Next up, we have item Number 3B, request to create one associate account clerk, one, grade 9 position, and abolish 2 vacant senior account clerks, grade 7 positions, legislative request number 032. Can I get a motion?
So moved.
Tonto and Amo. Okay,
These positions are specifically in our fiscal division. It does save some money. And our fiscal division is doing more and more complex work. We receive funding from a variety of sources, fees, fines, state, federal grants. I could go on. So it allows for us to give kind of more complex roles to the person in this position. Also, we're learning as we have a lot of turnover in that division that we really need to make sure our staff are cross-trained. And so this gives us more of an ability to cross-train staff for some of those more complex roles.
any questions or comments? Not seeing any, I'll call the question. All in favor, aye. Any opposed? Not hearing any, motion carries. And we have up next, item number 3C. Request to create one public health technician, Spanish/English, grade 11 position, and abolish one public health technician position. This is legislative request number 033. Can I get a motion? please? Sutherland?
Second.
Plus second, Tortel.
This is a position that had been vacated and due to promotion, I believe. And, it shouldn't come as a surprise that we have many Spanish-speaking people in our community, and a lot of those Spanish-speaking people, or a lot of the people working in restaurants and working in our permanent facilities, are Spanish-speaking. So this really allows us to have someone who can directly communicate with them more easily.
Questions, comments? Yes, legislative memo?
I don't think
And
I
then
think
we'll
it's
have
an
legislative fellow.
opportunity to embarrass myself in front of that party. I'm gonna have Yiddish speaking, English speaking too.
That's,
We are looking at other languages as well. It's, who's working in the back of the house at the kitchens, and to be able to speak their language.
Probably wouldn't find too many of those Yiddish speaking restaurants and stuff.
yeah, I think that's a great question. And we have looked, like Lisa said, we've looked at other languages too. We've had some requests from our Chinese speaking community too, because some of, their facilities are also permitted. Spanish speaking has been the biggest need that we've identified, so we're starting there, but we're certainly open to whatever the community needs.
Okay, legislative fellow.
Can you tell me the grade of the public health technician position that was eliminated?
That's a grade 11, it's a grade 10 for the trainee,
So a grade 11 is. a
grade 11 for a
position.
grade 11.
Which, oh, it's 11 for 11.
Yeah, the Spanish speaking is the same grade as the public health technician.
Okay. Any other questions, comments? No. Not seeing any, I'll call the question. All in favor? Aye. Any opposed? Not seeing any, motion passes, and up to the monthly update.
So I'll start with infectious disease, as we tend to do this time of year. Our flu rates, so I had said that they were decreasing. They've actually been stable over the past week, but overall they have been decreasing countywide. We had, I think it's 658 confirmed cases this week, so essentially the same as the week ending February 3rd. I will mention that our case rate for flu has been in the top 3 to 4 of New York counties for almost the entire flu season. So flu has been a real challenge for us this year. Other counties have kind of come and gone from those top 5 spots, but Orange County has remained pretty solidly in that top 3. I think right now we're at number 2. As far as COVID, hospital admissions are the main tracking device we have for COVID now. We don't track tests anymore. We do track COVID deaths, but that takes a very long time for those results to get to us. So we primarily track hospital admissions, and those have been decreasing. Our rates are considered medium. So there's a low, medium, and high that the state puts out, and right now they're medium, and they've been medium throughout most of this season. For RSV, respiratory syncytial virus, we've been hearing a lot more about this recently over the past couple years because it's tested for much more. And now, as of last month, it is reportable to New York State. So we have more accurate measurements in terms of numbers, but rates have been decreasing substantially, basically since November, December. So RSV isn't as much of an issue now, and that's true in the county and statewide.
How long will it take to catch up without the state wants to start tracking it?
So the good news is, for the most part, we don't have to look at individual cases of RSV, but they are looking at RSV pediatric deaths, similarly to what they do with influenza. Of course, it does take people a while to catch on that they need to start reporting in terms of labs. And so I don't think we'll have really accurate data until next season, and I'm hoping next season we'll start getting some accurate data. But like I said, we won't necessarily be keeping close track of every single case of RSV as much as we will with serious cases of RSV.
Okay,
And then we've been hearing a lot about measles lately. So measles cases are rising worldwide and across the United States as well, mainly due to low immunization rates. There have been cases in New York City, New Jersey, Pennsylvania. So we've been reviewing and updating our measles plans and protocols. We've been preparing for an exercise where we, would have to vaccinate large
meeting last month.
Thanks, Jeff.
We now have a board president, and we have a new member of the Board of Health, Jack Sepulveda, so he'll be attending hopefully our next meeting. And then as far as updates, I touched briefly on intervention services. We haven't talked about them in a little while. There have been a lot of changes at the state level and proposed changes at the state level in terms of early intervention, specifically in billing. So we've been discussing closely with them, with our local advocacy groups, to talk about how those changes will affect health departments and our families. We've received a scholarship to a training for a program called Help Me Grow. We'll probably be talking about this more in the future. I did put the Help Me Grow national site there. Helpmegrownational.org has a lot of good families of kids 0 to 5 with community resources, basic services, but with a focus on developmental screening and support. We continue to encourage and support school districts in creating their own 4410 preschools, which are special education preschools. The districts really have a vested interest in making sure they catch these kids early because these kids are going to be their kindergarteners in just a year or two. Newburgh is currently in the process of applying, which is fantastic. And we, have offered our services to help any other schools that are interested in applying. The state has said they'll try to streamline that process as much as possible. So we're hoping for more schools to jump on that bandwagon.
So far, we just have Newburgh.
We have Newburgh, Curious Joel, and there may be one other in the county, but it's a process. Typically, schools who are doing their own, districts who have their own UPK are typically pretty well set up for it. But the schools, a lot of times they have the physical facility, which is sometimes the toughest part. It's a matter of getting the staffing and going through the state process, which can be cumbersome. But like I said, they have a vested interest in making sure these kids get the best start possible. And then we'll talk about this again as it gets near, but we're having our annual collaborative conference that's for preschool and early intervention. And that's Sunday, April 28th at SUNY Orange. I think you attended last year. We have providers, childcare councils there, and then the SUNY Orange students who are training to work with those special education kids are there too. It's usually a pretty great event.
What's the date again?
It is Sunday, April 28th. And we have to do it on a Sunday because that's when they're not seeing kids in their programs. And then a few events coming up or that just happened. We had our Sweetheart Prostate and Breast Cancer Screening event on February 14th. It actually was a great program. There was a naturalization ceremony that got let out during our program. So we had a lot of those people come and learn about community resources. There was a lot of good food. The Renegades mascots were there. There was a DJ there, but they also had blood testing for prostate screening and breast cancer screening.
Where was that, in Newburgh?
It was at the Newburgh Armory on Valentine's Day. Yeah. I think next year we'll probably try to do it on a weekend, unless there's another naturalization ceremony happening at the same time. But it was a really great event, and it wasn't just screening. A lot of it was education around what's available. A lot of good vendors there. We had our food security and healthy eating work group last week, I guess. And then early intervention and our children and youth with special healthcare needs program are presenting at Port Jervis Library. We're really working on building these connections with libraries and the children's librarians to let them know, especially about children and youth with special healthcare needs, because it's a program that we're really trying to kind of build people's knowledge about. Our MRC training, or our MRC meeting is tomorrow, and we're doing a Narcan Train the Trainer. Our MRC Medical Reserve Corps has been really interested in this so that they can go out and then do Narcan trainings at schools or community organizations or with the public. And then we have our POPPY program. It used to be called Mitch and Pitch at one point. That's our home visiting program. Pregnant or Parenting People's Initiative is our new name for it. We have our advisory board meeting coming up next week.
Good.
As you go.
A lot of stuff going on, a lot of good things. Any questions or comments? Committee members? No? All right. With that being said, the desk is cleared and I'll accept the motion to adjourn.
So moved.
Patel, any, all in favor? Aye. Any opposed? Okay, motion carries. Thank you, everyone.
Ew.
Take care, Commissioner, Deputy Commissioner.